Joined this year by His Excellency President Ruto, also the President of Liberia and the Prime Minister of Tanzania. And we have many ministers and deputy ministers coming. Also, we have the Commissioner for Health, Humanitarian Affairs and Social Development of the African Union. So, an important meeting which aims to ensure that the needs of women, children and adolescents are not forgotten or overlooked in these great global meetings. We know that women, children and adolescents are those most affected during conflicts, most affected during all crises, and we really need the political leadership the leaders with us today are showing to see that no woman, child or adolescent is left behind. It's now my great honour to invite His Excellency Cyril Ramaphosa, President of the Government of South Africa and Chair of the Global Leaders Network for Women, Children and Adolescent Health, to give his keynote address. Mr. President.
Thank you very much, Your Excellency, Helen Clark, for your introductory remarks. And thank you very much for the heads of state and government who are here today. I'm so glad that we have three who have joined us from our African continent, and also heads of various international or global organizations who do a great deal of excellent work, and our ministers and deputy ministers who are here present. We are here today, and much as Her Excellency Helen Clark says, this is under my leadership. She's the real engine. She's the real mover and shaker of all this, and we really need to thank her and applaud her for her continued work that she does. And in thanking heads of states and heads of government for being here, we thank you for being here because the issue of health needs of women and children and adolescents requires urgent and sustained political leadership and attention by all of us. Now, at this 79th session of the United Nations, we have a great opportunity, an opportunity to accelerate the actions that need to be taken to continue achieving the Sustainable Development Goals that are particularly related to women's, children's, and adolescents' health. Because it is, as we saw on the video here, an area that needs a great deal of attention as we approach the 2030 deadline. Investment in development is declining. Inequality, as we can see it around the world and in various countries, is increasing, and the progress that needs to be there is stalling. This is manifest in the distressing population health and economic outcomes that are there for all of us to see in various countries. On average, across the world, and we saw some of the figures here, it is quite harrowing to hear that as this video just finished, 15 women will have died. And it is really concerning that so many women continue to die, and across the world a woman will spend 25% more time than men in poor health. This reduces productivity and earning potential, but it impacts negatively just on the basic human life, particularly of women, children, and adolescents. In sub-Saharan Africa, the likelihood of dying from childbirth is 50 times much higher than it is in a place like Europe. Each year, there are 35 million unsafe terminations of pregnancy. That is an astounding number. This is resulting in life-changing injuries for millions and the deaths of these many women who are subjected to this. In 2022, it is said that 4.9 million under 5 deaths were recorded, most of these from preventable causes. Low and middle income countries are in the end the most affected by this. They continue to face, the people who live there continue to face challenges of the fragility of their health system and in equitable access to health and health-related products. In 2022, an estimated 13% of adolescent girls and young women across the world gave birth before the age of 18. And in my own country, it has also been reported that girls as young as 11 are giving birth to children, thus dropping out of school, but more importantly, you can just imagine to their health themselves being so negatively and dangerously affected. And yet, we see a downward trend in donor aid for reproductive health and maternal and newborn child health as well. Countries are struggling with domestic funding allocations to cover all these essential needs. The Global Leadership Network provides a platform for leaders like ourselves to work together to address these persistent issues. And by leaders like ourselves, I'm not talking about the heads of state and government. And many of us who are here are leaders in one shape, form, or other, leading various organizations, various institutions, and various areas of activity. So once again, I thank Her Excellency, the Prime Minister of Denmark, Mette Frederiksen, and His Excellency President Ruto, and His Excellency Abiy Ahmed of Ethiopia, and His Excellency President Joseph Boakai of Liberia for joining this call to action. I thank His Excellency Julius Maada as well, Bio, of Sierra Leone, His Excellency Majaliwa of the United Republic of Tanzania, and also His Excellency President Faye, who would have been here but is of Senegal, for also joining in leading this initiative. We also appreciate the support of the WHO, as well as UNICEF and UNFPA as we move the global network leaders forward. Together, women and children and adolescents comprise more than 65% of the global population. Addressing their challenges, their needs, can in the end fundamentally shift the global health landscape. And this network will advocate for sustained and enhanced financial investment, contributing to the growth of nations and enabling individuals to reach their health potential. According to a report by a leading health economist institution, by addressing the health gap between men and women, we could boost the global economy by at least $1 trillion annually by 2040. By addressing the health gap, 137 million women could access full-time employment by 2040, lifting millions of women out of abject poverty. We must engage entities and organizations like the G7, the G20, BRICS, and many other blocs to carve out a focused agenda that ensures the necessary investments will be moved and flow into women, children, and adolescent health. This is an absolutely necessary area of investment. The Lusaka Agenda, which enhances coordination and accountability in health financing architecture, can be used to track investments. President Wigai, we knew that you were coming, and I'd like to welcome you as you arrive. So don't worry too much, you're sitting next to me, so you're okay. Now, in September last year, governments and philanthropic organizations committed to increasing investments to end the shortfall of funding for life-saving family planning supplies. These commitments must be upheld. The life planning area is another important aspect that we need to look at very closely. We need to give greater attention to ending gender-based violence as well. We have also seen that the high rates of unintended pregnancies contribute to maternal mortality, especially among young girls. The UN and the African Union, through the Maputo Protocol, recognizes the right to bodily autonomy, especially for girls and for women. Yet we continue to grapple with this question of termination of pregnancy at the political level. And as we watch television, we see the debate raging in a number of countries, and particularly some big and leading countries where a lot of electioneering is taking place. And did I say that in the wrong place? I shouldn't say things like that in a place where these things are happening. And this is even the case, though the WHO has presented evidence that where abortion is legal and where safe services are accessible, both unsafe abortion and abortion-related mortality and morbidity is reduced. The Global Leaders Network advocates for life-saving interventions as well as sexual and reproductive health rights. Now, as South Africa, we know this from experience. The Choice of Termination of Pregnancy Act, which adopted soon after our own freedom, contributed in 1996, contributed to a decline of termination of pregnancy-related mortality by 90% between 1994 and 2021. This law that was passed through a democratic process amidst robust debates and significant pushback, but it is now being implemented, and it has resulted in a great deal of progress and success. But in the end, scores of women's lives have been saved. Prevention of unintended pregnancies, comprehensive sexual education, and preventing violence against women and girls are still priority interventions, but complementing these with sexual and reproductive health rights can save more lives. We understand that countries have the sovereign right to make determinations on issues of termination of pregnancy, and that should be respected, because in the main, it could be an expression of the will of the people. The Global Leaders Network is called upon to protect the rights of vulnerable populations and present evidence that demonstrates a reduction in morbidity as well as in mortality. We therefore issue a call to action. We call on heads of states and government to seriously take women and children and adolescent health up in everything they do and join the Global Leaders Network. We also call on countries, as well as on donors and commercial and developmental investors, to carve out a specific funding agenda for women, children, and adolescent health. And we do, yes, also make a call on countries across the world to collaborate and to work together and cooperate to meet the financing targets for organizations that support women, children, and adolescents' health. These include the Global Financing Facility, UNICEF, and UNFPA. We call on stakeholders in the women, children, and adolescent health sector to target those countries with the highest maternal, neonatal, and adolescent mortality rates. And there are quite a number of these. And we also call on academics and civil society to continue to provide evidence and compelling arguments so that urgent political attention and action can be taken, including investment in the health that affects women, children, and adolescents. And we call for equity in manufacturing, in access to sexual and reproductive health products, and in quality health services for women, children, and adolescents. And that should lead to the health systems being strengthened. And that also should address the health outcomes in the end. Now, as the chair of the Global Leaders Network, I want to thank everyone who's been involved in this critical initiative. And by your mere presence here and the work that many of you continue to do in your various positions and organizations, you are helping to move the needle. But we need to do much more to save the lives of millions around the world. And we can, I believe, reduce poverty and inequality. We can, I do believe firmly, that we can improve productivity and develop economies and transform communities across the globe by improving the health outcomes for women, for children and adolescents. We will be taking steps in that direction. So if we all act together, but not only act together, but we need to raise the level of awareness and consciousness, because quite often you find that many people are not so aware and well conscientized about the alarming statistics that we saw in the video, that women continue to die needlessly, and yet we can take action to prevent that and to lessen the deaths of women, but to also improve their health. Women, children, and adolescents must be prominent in our agendas to improve health across the world. And so if we can continue with that resolve, we will certainly achieve a number of objectives. Thank you very much for being here.
Thank you, President Ramaphosa, for your leadership and for the keynote address. And it was really touching to hear that when the freedom of your people was achieved, women's sexual and reproductive health and rights were also secured at that time. The two went together, and we thank you for your passionate commitment to these issues and for speaking from the heart. Thank you so much. Now, I would like to invite His Excellency Dr. Ruto, the President of the Republic of Kenya, to come forward and tell us about his vision on how we can accelerate action to end preventable maternal, newborn and child mortality. Dr. Ruto, you have the floor. Thank you.
Thank you very much. Excellencies, distinguished ladies and gentlemen, it is inspiring for me to know that we are all here to actualize our shared aspiration to address missed opportunities in improving the welfare of women, children, and adolescents with urgency and a spirit of partnership. The Sustainable Development Goals and the Global Strategy for Women's, Children's, and Adolescents' Health were launched in 2015. Yet with only 5 years remaining to meet these goals, only 16% of targets are on track, while an overwhelming 84% show limited or no progress. It is deeply concerning that maternal mortality, stillbirths, and neonatal deaths remain critical issues in sub-Saharan Africa and Southern Asia. In 2020, these regions experienced 300,000 maternal deaths, 1.9 million stillbirths, 4.9 million under 5 children's deaths, and 1 million adolescent deaths. Although Kenya has made considerable progress in reducing maternal and under 5 mortality, challenges such as inadequate funding and limited capacity to provide essential services persist. We recognize that only a multi-sectoral approach, including healthcare, education, and community support, can accelerate mortality reduction. Towards this end, it is therefore essential to increase investment, enhance collaboration, and focus on primary healthcare to scale up key interventions like skilled birth attendants, vaccinations, and improved nutrition. Recognizing that only urgent collective action can save millions of lives by 2030, we have pledged to enhance partnerships and establish a dedicated fund for maternal and child health. This fund will help advance progress towards SDGs by improving service delivery and expanding access to essential care. From an economic perspective, keeping people healthy is immensely beneficial. Studies show that every dollar invested in maternal and child health yields $9 in returns through improved health and productivity. Any annual investment of $1.5 billion US could save 35 million lives by 2030 and generate $100 billion in productivity and healthcare savings. We have a singular opportunity to escalate our contributions to global health initiatives and significantly enhance their impact by supporting Africa Health Strategy and KAMA campaign, that's campaign on accelerated reduction of maternal, newborn, and child mortality in Africa as an ideal starting point. It is important to emphasize, however, that investments must be complemented with robust transparency and accountability measures. This is why Kenya supports initiatives like the Africa Peer Review Mechanism and Reproductive Maternal, Newborn, Child, and Adolescent Health Scorecard to track progress and to prevent unnecessary deaths. The return on investment in adolescent health is estimated at between $5 and $10 US spent, with school-based and community-targeted interventions being highly effective. In Kenya, therefore, we are deploying community health promoters to bring vital health information and services directly to communities as part of our commitment to a sustainable and equitable future by securing the health and well-being of all women, children, and adolescents. We have had a robust conversation in Kenya we had two programs that were running. One, Linda Mama, that was an insurance program to make sure that every mother who is going to give birth, the government of Kenya pays for the prenatal and postnatal services. We have since, under our new universal healthcare program, expanded that to include the child up to 5 years, so that we can take care of that moment in time when children are most vulnerable, between ages 0 and 5. We have also expanded what initially we called Edu Afia, or Education Afia, where we had an insurance program for all our secondary school children. Under our new program, we have expanded that to include every child from primary school to age 18, so that every adolescent has a government-paid for insurance program to take care of their health needs. This expansion of the programs that we are undertaking is in partnerships with friends. And I am very happy that in this audience, Professor Senait, who is here, has been working with us and has gone out of her way to pay for some of our women and children in that program. It is a complementary partnership between private and public in making sure that we secure the health of our people. We have every reason to be confident that together, as President Ramaphosa said, we can create the future we envision by prioritizing equity and inclusion in healthcare access, increasing funding, and strengthening our commitment to SDGs. If we can act in unity and without delay, nothing can stop us. And I'm very confident that we will work this together, and you have our solidarity, support, and partnership. I thank you.
Thank you so much, President Ruto, for that strong commitment you expressed, and also for the focus on the primary health care, the skilled birth attendant, the vaccination, the nutrition, the whole package that is so important in achieving these aims. I'm now going to welcome His Excellency President Boakai of the Republic of Liberia to come and speak to us about his vision for putting women, children and adolescent health and well-being as a top priority on the global agenda. Mr. President.
Your Excellencies, distinguished ladies and gentlemen, it is a privilege to address this critical discussion on the health and well-being of women, children, and adolescents. This dialogue is essential as we work together towards achieving the 2030 Sustainable Development Goals, particularly the SDG 3, which focuses on health and well-being for all. Liberia is fully committed to this endeavor. We have made progress in reducing maternal and child mortality and expanding access to health care, yet challenges remain. Maternal mortality rates are improving, but still unacceptably high, and child mortality persists as a concern, particularly in the rural areas. Additionally, our adolescents face unique health challenges that require targeted responses. Political leadership has been pivotal in our achievements. Through strategic policy initiatives and strong partnerships, we have integrated health priorities into our national development plan. Our focus remains on several key areas. Maternal and child health. We are expanding access to parental and to prenatal and postnatal care, ensuring essential medicines are available, and training healthcare workers to provide high-quality care. Our commitment to reducing maternal and child mortality is steadfast. Adolescent and health and well-being. We are recognizing our adolescents as future of Liberia. We are enhancing sexual and reproductive health education and expanding mental health services to prevent adolescent pregnancies. Universal health coverage. Achieving universal health coverage is fundamental to providing all Liberians with necessary health care. Our Liberia Health Equity Fund is nearing approval, aiming to ensure every citizen can access health services without crippling out-of-pocket fees. Mental health. We are expanding mental health programs and facilities to reach undeserved communities, recognizing the crucial and critical importance of mental well-being of our women. Despite the challenges of limited resources and ongoing global health crisis, we see opportunities to grow through international cooperation. Increased investment in health systems and capacity building will be very vital. Political leadership is crucial for accountability and resource mobilization to meet health-related SDGs. It is our duty to advocate for equitable healthcare access and integrate health priorities into our national agenda. I remain very much committed and I reaffirm Liberia's commitment to achieving health-related SDGs by 2030, especially for women, children, and adolescents. I urge all nations to join us in the shared responsibility to secure the health of future generations. With strong leadership and collaboration, we can ensure every woman, child, and adolescent has the right to health and well-being. Together, we will realize the vision of 2030 agenda. I want to thank you for your attention and dedication to this important cause. Thank you.
Thank you, Mr. President, and also thank you for emphasising the issues for adolescents, an area which the Partnership for Maternal, Newborn and Child Health has put a lot of focus on in recent years. Thank you for your leadership. I would now like to welcome here the Prime Minister of the United Republic of Tanzania, also speaking on improving health and well-being of women, children and adolescents as an aspect of national development. Prime Minister, you have the floor.
Excellencies, heads of state and government who are here, distinguished participants, at the outset, on behalf of Her Excellency Dr. Samia Suluhu Hassan, President of the United Republic of Tanzania, allow me to thank Your Excellency Cyril Ramaphosa, President of the Republic of South Africa, for convening this important event and for your regional and the global leadership in maternal, newborn child, and adolescent health. Your Excellencies, last year, you rightly noted that if we secure the health of child and women, we will improve the health of all humanity. Yet, we are far from achieving the Sustainable Development Goal of reducing maternal deaths for 70%, 100,000 by 2030. Alarmingly, about 800 women die daily from preventable causes related to pregnancy and childbirth around the world. This situation compels us to act decisively and prioritize a better future for every child. Excellencies and dear delegates, this meeting is important to agree on actionable steps to accelerate progress in women, children, and adolescents' health. Effective leadership is essential to strengthen health sectors and expand access to primary care. Long-term sustainable funding is critical. Every dollar or cents invested in health yields substantial societal dividend. Additionally, sharing best practice and focusing on data analysis will enhance our collective efforts. Ladies and gentlemen, in Tanzania, women of reproductive are 47.3% of all women. The latest survey shows that our maternal mortality ratio has declined by 8% between 2026 and 2022. While we have seen improvements in child mortality, the neonatal mortality rate has stagnated. These achievements highlight the importance of leadership, financing, cooperation, and monitoring in meeting of our health goals. Excellencies, heads of states, ladies and gentlemen, with these few remarks on behalf of the government of the United Republic of Tanzania, under the able of leadership of Her Excellency Dr. Samia Suluhu Hassan, Tanzania pledges its support to the global leaders, Network for Women, Children, and Adolescents' Health. Maternal and newborn health is a top priority for us, and we are eager to collaborate with the global leaders to reach the crucial target. Thank you for listening.
Thank you so much, Prime Minister, and please pass our thanks back to the President for the priority she is giving to these issues. I'm now going to call on two ministers. Firstly, Dr. Ibrahima Sy, Minister of Health and Social Action, on behalf of the President of the Republic of Senegal. Minister, you have the floor.
Merci beaucoup. Excellences, honorables, distingués invités. Au nom de son Excellence, M. Bassirou Diomaye Diakhar Faye, Président de la République du Sénégal, je voudrais remercier la mission permanente de l'Afrique du Sud de nous avoir conviés à cette importante rencontre du réseau des leaders mondiaux sur la thématique du leadership politique pour assurer la santé et le bien-être de chaque femme, de chaque enfant et de chaque adolescent à l'horizon des objectifs de développement durable de 2030. Le projet pour un Sénégal souverain, juste et prospère référentiel de la politique économique et sociale dans le moyen et le long terme, fait de l'amélioration de la santé en général et de la santé maternelle, néonatale et infantile en particulier, une priorité placée au cœur des politiques. La santé de la mère et de l'enfant est un indicateur de la qualité des soins du niveau communautaire au niveau de référence. Elle constitue un facteur de développement économique et social qui a d'ailleurs conduit au Sénégal à la création de la direction de la santé de la mère et de l'enfant. Le Sénégal a connu ces 20 dernières années une réduction importante de la mortalité maternelle de plus de 60%. Le classement en deuxième position comme bon élève derrière la République du Cap-Vert en illustre bien ce résultat. En effet, d'importants progrès ont été réalisés dont nous pouvons relever. Le ratio de mortalité qui a continuellement chuté selon les enquêtes démographiques et de santé, passant de 392 décès pour 1000 naissances vivantes en 2012 à 153 décès pour 1000 naissances en 2023, soit une réduction de 40%. La mortalité néonatale est passée de 29 à 23 pour 1000 naissances vivantes entre 2012 et 2023. Dans la même période, la mortalité infantile-juvénile a inscrit une cible très importante en passant de 65 à 40 pour 1000 naissances vivantes. Le taux de prévalence contraceptive est passé de 12 en 2012 à 26,5 en 2023. Des actes forts ont contribué à l'atteinte de ces résultats suscités parmi lesquels on peut
tangible results which we can
la mise en place du couple des gagnants qui a permis la disponibilité d'un infirmier et d'une sage-femme au niveau des postes de santé pour une meilleure prise en charge de la grossesse, de l'accouchement et du postpartum.
a midwife and a nurse to each
La priorisation de la spécialisation des médecins en gynécologie obstétrique, pédiatrie, anesthésie et
we've been able to develop
en octroyant
pediatric and other
qui passe de $245 à $490. L'amélioration de la disponibilité des ressources humaines dédiées à la prise en charge de la santé du couple mère-enfant par le recrutement dans la fonction publique et la contractualisation de plus de 2000 femmes sages-femmes d'État, d'infirmiers et de médecins. La promotion de la demande de soins en santé reproductive par l'intervention de ce qu'on appelle les badiens marraines de quartier. La gratuité de la césarienne et des soins chez les enfants de moins de 5 ans. La redynamisation de la surveillance des décès maternels, néonatales et périnatales et périnatales. Le renforcement de la gestion des urgences néonatales et pédiatriques. La mise en place d'un réseau périnatal et la mise en place d'un réseau de soins obstétricaux et néonataux d'urgence et le renforcement. La mise en œuvre de toutes ces politiques ont été facilitées et soutenues par la nécessité des sociétés civiles dynamiques et des politiques de santé communautaire. L'option du gouvernement a été une approche inclusive, transparente, avec la pleine participation effective de toutes les parties prenantes. Malgré ces avancées significatives, le Sénégal connaît toujours des problèmes ou des défis en matière de santé de la mère et de l'enfant, et que le nouveau gouvernement va s'atteler à prendre en charge à travers la politique de dynamisation des soins de santé primaires, mais aussi le renforcement de la couverture sanitaire universelle
primary
mais
health care,
également la
as well as
continuité des services
developing
de
universal
santé
health services,
reproductive maternelle
as
et
well
néonatale
as
infantile de
reproductive,
l'adolescent.
infant,
Enfin, le Sénégal
children's services.
réitère son engagement à œuvrer avec toutes les parties prenantes
We reiterate
pour
our
l'atteinte des ODD
commitment
en
to
l'an
attain
2030. Je vous remercie de
SDGs
votre aimable attention.
by the year 2030.
Thank you very much, Mr Minister. And can I immediately call on Dr Austin Demby, the Minister of Health of Sierra Leone, who has remarks to deliver on behalf of the President. Mr Minister.
Your Excellencies, distinguished colleagues, esteemed partners, ladies and gentlemen, it is a great honor to address you today on behalf of His Excellency, the President of Sierra Leone, Brigadier Retired Dr. Julius Maada Bio, at this important and critical moment. I'd like to begin by expressing my gratitude to His Excellency, President Cyril Ramaphosa, for his leadership in convening this crucial discussion through the Global Leadership's Network. Today, we reaffirm our shared commitment to securing the health and future of every woman, child, and adolescent across the globe. The Sustainable Development Goals, especially Goal 3, demand that we end preventable maternal, newborn, and child mortality by 2030. While progress has been made, far too many mothers continue to die in childbirth, and too many children do not live to see their first birthday. This is a global emergency, and it is within our power and responsibility to change these outcomes. In Sierra Leone, we have adopted a life stages approach to health service delivery, which ensures that at every stage of life, whether childhood, adolescent, or adulthood, health services are accessible, equitable, and tailored to the individual's needs. This approach ensures no one is left behind, and it has been central to our progress in reducing maternal mortality by over 60% in the last couple of years. However, we know there is still much to be done to achieve our goal of reducing maternal mortality to less than 70 per 100,000 by 2030. Achieving this will require not only strong political will, but also sustained financial investments. The global disruptions caused by COVID-19 have compounded existing challenges in health financing. Sierra Leone is exploring innovative mechanisms such as blended finance, debt for health swap, and public-private partnerships to mobilize necessary resources. But we need global cooperation to ensure that every investment translates into directly saving lives. As we look to the future, our actions must be accountable. In Sierra Leone, we are strengthening our reproductive, maternal, newborn child, and adolescent health platform to monitor progress, learn from setbacks, and ensure that every woman, every child, and every adolescent receives the care that they deserve. Together, with bold leadership and sustained partnerships, we can build a future where no woman dies in childbirth, no child dies from preventable causes, and every adolescent can thrive. The decision we make today will shape the future of the generations to come. Thank you.
Thank you very much, Minister, and our thanks back to your President too. We're going to have 3 quick-fire interventions now. And I want to invite Professor Sine Fiseha from Susan T. Buffett Foundation to come and share some insights on the roles of foundations. 2 minutes to you, Sine. Thank you.
Good afternoon, Excellencies, colleagues, partners. I am delighted to be here. President Ramaphosa, it's really a tough act to come after you. I think it's easy to say I endorse everything he had said. So I think we heard clearly today, and we've been hearing it every day, that the lives of women and girls are on the line. We are far behind the SDG targets. There is stagnation on maternal mortality, child mortality, but also increasing hostility towards reproductive health and rights from within countries and outside of countries. I do struggle when a woman's right to control her body becomes a debate, and a debate that is framed as one that is being pushed by foreign agents, religious groups. It's really mind-boggling. And I also struggle, especially as an African woman, a culture that tolerates violence against women, a culture that tolerates children giving birth and kind of framing it around teen pregnancy, normalizing a culture that accepts children to be mothers when they have not fully self-actualized, debates their ability to terminate a pregnancy. So I'm incredibly inspired to see African leaders led by President Ramaphosa coming together, and global leaders to push this agenda, to not only say women have a right to control their body, to determine their bodily autonomy, have a child by choice and not by chance, but also integrate services. I think for too long, global health has fragmented and provided services by body parts, right? It's, a woman accesses a safe abortion and then she dies in childbirth. It's a zero-sum game. Or if her child doesn't survive, she will continue to have babies. In sub-Saharan Africa, women are, and in Asia and other parts of the world, children are insurance. You give birth, you raise children, you take care of them, and then they turn around and take care of you. So if they don't survive, you continue to have children. So child survival cannot be delinked from maternal health. I know I have to be brief. I know we have all the tools in the continent. We've worked with President Ramaphosa, Prof. Olive, the African Union. We have the African Union campaign on ending violence against women and girls, the African Union Men's Conference on Positive Masculinity to end violence against girls. Both of them have been championed by President Ramaphosa, the Maputo Protocol. We are not short of frameworks, legislations, guidelines. I think where we're failing is at implementation and fragmentation, and frankly, earmarked budget to countries and punting countries around and using them as a token on the global stage instead of really investing in them in a profound and meaningful way, and in a way that allows them to integrate services based on their national priority. So we are enormously proud to partner with almost everyone on the stage here, from Sierra Leone to Tanzania to Liberia to South Africa to Senegal, and showing up in the way that we're asking other donors to do and partners to do, but without ever compromising on our commitment to women and girls. So we are thrilled to be part of this stage. We are grateful for our UN partners who have been really bold at different times, like COVID. Dr. Tedros, your leadership both at the country level, at the global level, and your unapologetic stance to defend women's rights has been exemplary. Natalia, your leadership at UNFPA, commitment to integrate commodities and not just, pick and choose what is convenient or what's demanded by donors has been exemplary, and we're really looking forward to partnering with you, Catherine, and UNICEF to tackle adolescent health. In sub-Saharan Africa, if we can just fulfill the contraceptive needs of adolescents, will reduce unintended pregnancy by 60%. So we look forward to working with you. It's a privilege to be part of this movement. Thank you.
Thank you, Sinead, and thank you so much to the Susan T. Buffett Foundation for its unstinting support in this area. We have 2 minutes now from Professor Mosa Moshabela, who's going to talk, I think, a little about the economic case. Thank you.
Very much. Your Excellency, heads of governments and states and ministers, ladies and gentlemen, I have the burden and the privilege of heading the University of Cape Town in South Africa, which is touted as one of the best, if not the best, on the continent. And unfortunately, one of our eminent professors who passed away some years ago in 2018 used to say, "What is the point of being number one in a sea of suffering?" This is important because sometimes we are seen as ivory towers as universities. But we have seen examples of success in the past where we worked collaboratively with government, with civil society, and communities to solve complex problems. The problem we are facing is tough, is complex, and it needs all hands on deck. We must not lose the lessons that we've learned from COVID-19, where all hands were on deck. It's so easy to forget what it took to cope with the situation and to some extent overcome. We are a hub of talent as a university, a lot of expertise, and for us to support the political leadership that is now spearheading the Global Leaders Network on this problem requires our experts to assist governments and our political leaders by providing the evidence that they need to tailor the solutions to solve the problems. Here's the issue. Implementation is a problem that requires implementation science. Our experts can bring that. Data analysis is a problem that requires data analytics, and our experts can assist and contribute to this. Also, for each country that we have to assist, the tapestry of that country is different. The combination of interventions and the scenarios that we need require unique considerations of those countries at national and sometimes at subnational level. We are willing and we are committed to working with every country that is willing to be part of this network to solve this problem. There are universities in each of those countries, the networks of universities like Arua, of experts that have made themselves to be part of the societal solutions. I am here to affirm our support as a member of the academia and experts to help support the political leadership that has come together to solve this problem. We know that the decisions that need to be made in the context of constrained resources require careful selection of interventions and configuration of interventions in the context of resources that are limited in order to achieve the highest impact that we can see in the shortest possible time. These decisions are not going to be easy. And all I am saying and all I want to contribute is to say that we are here to provide support. Thank you very much for your leadership.
Thank you very much, Vice-Chancellor. Can I now ask to the stage Bertha Chulu, who is a young advocate from Zambia, who's going to bring us a message. Bertha.
Greetings, Your Excellencies, distinguished guests, all protocols observed. Dear world leaders, this is the world that we want, a world where every girl can achieve an education, where she doesn't have to miss class because she cannot manage her menstruation, where she learns not just reading and math, but how to care for her health and stand up for her rights. When I was in school, I faced many barriers. I missed a lot of classes due to menstruation. My girls' school was known for having a high rate of teenage pregnancies, and in 1 year, in just 90 days, we had recorded 64 of them. I watched my friends leave school and never returned. This is my story, and it's a story of countless girls around the world. Millions of us do not have access to our basic rights to health and education. In Zambia, where I'm from, girls are more likely than boys to drop out of school, especially once we reach puberty. We face challenges like lack of menstrual hygiene products, risk of sexual violence. Now, if we are losing women and girls at the rate that we are losing them today, who then are we going to lead? We also face teenage pregnancies and the pressure to marry young. This doesn't have to be this way. It does not have to be this way. We have solutions, we just need the will and the resources to implement them. Comprehensive school-based health programs like the one being implemented by Healthy Learners in Zambia has shown how we can support children and adolescents to keep them in schools and help them stay healthy. Let us make health and education a top priority. Don't make us choose between our education and our safety. Don't let society force us to marry early or have children before we are ready. Let us dream big and achieve those dreams. I call on you to invest in women and girls, protect us against child marriages and gender-based violence, and create spaces for us to learn, to lead, and to thrive. The world we want is within reach, but we need your leadership and action to get there. Let's work together across generations, across borders, and across genders to build a world where every girl has limitless opportunities. Healthy, educated girls become women who lead, who drive change, strengthen economies, and shape the future of our nations. Back home, we say, to catch a thief, you must be one. The solutions to children and adolescent pregnancies are children and adolescents themselves. Dear world leaders, this is the world that we want.
That's a wonderful message. Thank you so much, Bertha. Now, before we go to our three heads of agency who are still here with us to wind up, I have Maria Antonietto Alcade Castro, who chairs PMNCH's Civil Society Organisations constituency, who's going to share a call for action from civil society. Maria.
Thank you so much. And Berta, what an inspiring message. So thank you for being here with us. And it's an honor for me to be here on behalf of civil society. And as a Latin American feminist, I know that for far too long, we have been advocating for stronger political and financial commitment to ensure the rights and the health of women, children, and adolescents. The urgency of this issue cannot be overstated, and we have heard about it like in this event. And during all this week, sexual and reproductive rights are human rights and are crucial for achieving health and equity. This issue goes beyond health. It requires immediate and concentrated action across multiple sectors to address the root causes of these poor health outcomes on these populations. We, civil society, know the power of the United Head of States. We know that you can unite efforts for comprehensive multisectorial response. And we urge leaders around the world to stand with President Ramaphosa in this vital initiative. And it's very inspiring to see all of you here today, but also know that civil society will be following and making you accountable for these commitments. And the power of this unity, the power of working together, is what will allow us to accomplish what we want. Now is the time to create a lasting legacy. By acting decisively today, you can transform billions of lives and reshape the future of global health. Your support can ensure that every woman, child, and adolescent can enjoy the rights we deserve and thrive in a world that actually values our health and dignity. There is no time to lose. Join us now in this cause for better and more equitable future for all. Thanks very much.
Now, listening to our afternoon session have been three heads of UN agencies who are just all so supportive of this agenda. And I'm going to call each of them, starting with our great friend, Natalia Kanem.
Your Excellency, President Cyril Ramaphosa of the Republic of South Africa and Chair of the Global Leaders Network, Excellencies, the Vice President Martin Abregu of the Ford Foundation, it's a bit of a homecoming for me here, distinguished guests, partners, and colleagues, my greetings are of peace, echoing our Secretary General's statement this morning. I would like to thank you, Excellency President Ramaphosa, for your bold leadership as chair of this network. Today, I believe we are more united than ever in our resolve to secure the health of every woman, every child, every adolescent, everywhere. Right now, alarmingly, 46 countries off track to end maternal mortality by the year 2030. And another 59 countries expect to fail in keeping babies and children alive, and that is simply unacceptable. When every 2 minutes a woman dies in pregnancy and childbirth, it's a preventable cause. And typically, this woman is not a woman at all. She is a girl. 2 million newborns dying each year from preventable complications. Again, we're speaking of irreplaceable, precious lives. So when progress stalls, we have to ask, why are these hard-won gains eroding, and what do we do to accelerate progress and move the needle again? And we already know what works. Number one, invest in integrated reproductive and maternal health services. Number two, expand access to midwives. Midwives save lives and other skilled health workers. And thirdly, get quality reproductive health commodities to women and girls without delay and in an increasingly humanitarian catastrophe type of scenario in the world, make sure that we deliver to the last mile. And it is no mystery that maternal and newborn health are inextricably linked to women's rights, to gender equality, to a woman's ability to safeguard her own health, her own body, her own future, which stands to the benefit of her own children and society at large. So I'll close by saying that I stand on the evergreen platform of that International Conference on Population and Development, the ICPD Program of Action, and the Beijing Declaration that followed it in 1995. 30 years later, evergreen. Because rights and choices matter. Because when women are active agents in their own lives, real change happens, and that includes the peace building. And when adolescents, as we just heard from Bertha, are part of the conversation, they will shape their collective future and our collective progress. So thank you, Tedros, for the World Health Assembly. I think it's historic that in your resolution this year on maternal, newborn, and child health, we have an opportunity we can seize. And where there's a will, there's a way. And I think that's what inspires us. When we talk of political will, we have seen that on display here today. So thank you. I would like to close by quoting the proverb that says, the best time to plant a tree was yesterday. The second best time, today. So please let us waste no more time. Let us pray and work and take action for peace, which is the precondition for our partnerships to succeed. And let us keep our hope and determination alive. Thank you so much.
Thank you, Natalia. Next, Catherine Russell, Executive Director of UNICEF, a constant champion for the girl child. Thank you, Cathy.
Thanks. So good to see you. Thanks so much. Thank you, Helen. And Excellencies, honorable guests, colleagues, I'm really honored to join you today as we build on the commitments we made last year at UNICEF House. We feel a special pride in what's happening here today. I'd like to thank President Ramaphosa for bringing this fantastic group together, really terrific, and also to President Ruto and President Bukoy, of course. And I'd also like to thank my incredible UN colleagues. I think these are the representatives of two of the best UN agencies, and I feel so heartened to have them as partners in this effort. I'd also like to say that I fully endorse everything Bertha said, and I feel like I could sit down after she spoke because she was so fantastic. So, since 2015, when the Secretary General launched the global strategy, we have made significant progress, and I think we have to keep that in mind. Just this year, we reached a historic milestone, reducing child mortality by half since 2000. This is really a remarkable achievement in terms of the sheer number of children's lives that have been saved. And it's an achievement that would never have been possible without strong political leadership. And it's, again, why the political leadership here in this room is so critically important. Today, your leadership makes the biggest difference. The combined effects of conflict, climate change, and contagion are threatening the hard-won gains in maternal and child health. Health systems that are already fragile and under-resourced are at risk of buckling under added strain, while under-supported health workers are struggling to meet increased demands in their communities. It really is past time for us to act. This means investing in the services and systems, especially community systems that women and children rely on. It means expanding access to robust, resilient primary health care and life-saving vaccination services. And it means supporting community health workers, who are mostly women and who are an absolute top priority for UNICEF. Where and how we do each of these things is as crucial for impact as what we do. Children in lower income countries and in places affected by conflict face the greatest risk of death. If we focus our actions on countries with the highest mortality rates, including many in West and Central Africa, places like Sudan, Gaza, and Yemen, where children are exposed to conflict, we can bring child mortality rates down significantly. Excellencies, we really are at a critical juncture where our work can shape the future of women's and children's health, where our efforts can keep more women and adolescents alive and healthy, and where we can ensure that more babies and children survive and thrive. This effort could not be more urgent. There is much to do ahead, but you can count on UNICEF as a committed partner in our shared mission to uphold the rights of every woman, child, and adolescent to quality health care that they deserve and that they need. Thank you very much.
Thank you, Catherine. And now to the man who needs no introduction whatsoever, Dr. Tedros, a tremendous champion for everything we're talking about here today. Thank you.
I actually need introduction. Secretary General Kofi Annan, he was speaking and someone said exactly like he said. And he said, Kofi Annan said, I need introduction, and he told a story. The story was, he was on a vacation in a village somewhere that he thought he wouldn't be known. While walking, some kids were coming towards him, kicking and screaming with some papers in their hands. He couldn't hear what they were saying, but when they approached him, they were saying, Morgan Freeman, Morgan Freeman. Then, poor Kofi Annan, he signed Morgan Freeman to the kids. He didn't want to disappoint them. So, Your Excellency President Ramaphosa, Your Excellency President Boakai, Your Excellency Prime Minister Majaliwa, the Right Honorable Helen Clark, and my colleagues Natalia and Kathy, my sister Professor Senait, Excellencies, Ministers, dear colleagues and friends. Everything that I was going to say has been said. One, I think I don't want to repeat all the figures, how many kids are dying, how many mothers, that progress is told, everything has been said. And I endorse all that, but just want to say one thing in the interest of time, just one issue. I just came back from Sudan, from a visit to Sudan and from a visit to Chad. And I could see the problems inside Sudan, the places I visited, especially its impact on women, children, and adolescents. And from Chad's side, we visited the Adre village, which is Adri, which is a border town between Sudan and Chad. And the situation in Sudan is really tragic. I think the crisis is forgotten. That's what I felt. I met mothers from both sides in Sudan and also the refugees in Chad, and they tell you horror stories. Their houses burned, their crops destroyed, their cattle stolen, and they left empty-handed, mothers and children, and nothing actually. And when I ask them, what help do you need? The only thing they say is, we're hungry, because they don't care about what they lost now. They want to survive. And you can see the horror from the figures, by the way. Half of the population needs aid, 25 million. And quarter of the population has already fled, displaced, I mean. That's around staggering close to 13 million. Close to 9 million of them internally displaced, and the additional 2-point-something million refugees fled to all the neighboring countries. The largest is in Chad, where we visited, by the way, more than 640,000. It's very, very serious. If there's one message, I think we should really give more attention to women and children in conflict. When I was in Adre, the refugees, 94% of them were women and children. And the most affected are women and children. And the mortality and everything is high in them. So that's the only thing I would like to add to what all that has been said. Let's not forget Sudan and, of course, other conflict areas. I think it's in conflict areas where you see the worst. So that's the only message I would like to add. I think the rest has been said. But I don't want to stop to end my message without thanking our leaders, President Ramaphosa, President Ruto, President Boakai, and Prime Minister Majaliwa. It's this high-level political commitment that will help us to deliver the result. And I'm so proud that you're showing that, especially to President Ramaphosa, for your leadership. I think your political commitment will help also mobilize your colleagues, because it's the highest level possible, and with a political commitment that we can deliver result. So thank you so much. Please accept our leaders, our deepest respect and appreciation. Thank you.
Thank you, Tedros, for reminding us of the plight of the people of Sudan, which is much overlooked in international reporting, and we know you've been on the front line, and thank you for bringing their plight to our attention again. And once again, thank you, President Ramaphosa, for mobilising these amazing African leaders who've come with you today. Thank you to all of you. The leadership is just outstanding. And we really value the commitment that you're making to this cause and leading the network. Thank you so much. We're over time. We're letting you go, but it's been a wonderful event. Thank you.